And good luck, Dora.
Thank
No,
you.
no, it's gonna be great. It's gonna be exciting. It's gonna be great.
Ready when you are, Stavros.
Thank you, Ollie. Hi, everyone, and welcome to the 7th International Webinar sponsored by the World Federation of Athletic Training and Therapy. My name is Stavros Daoukas. I'm committee member of the Research and Education Committee of the WFATT and president of the Greek Association of Sports Therapy and Rehabilitation. And I'll be your host today for today's presentation. It is important to mention that we're hosting this webinar alongside Basrat. So we just want to send thanks to Basrat and Ollie for helping us host this webinar today. Once again, it's so lovely to see so many people from all over the world attending this webinar we've put on today, and we're also excited for having our special guest speaker today. So today's presentation will focus on the importance of the interdisciplinary approach, the individualized care of our athletes, and the importance of the biopsychosocial element of an injury. It will also look at how to implement the biopsychosocial approach in sport and exercise medicine, how it works in our everyday practice, and how the interdisciplinary team can work beyond their own scope of practice in order to inspire and empower our athletes to engage with the treatment. Before we go on to the presentation, there's a few housekeeping notes. First of all, the session will be recorded and uploaded on the World Federation website for future reference. The presentation will be approximately 60 minutes, followed by 30 minutes of questions. And questions can be submitted in writing during the presentation by using the Q&A feature. And then what we will do, we're going to go through all the questions from you after the end of this presentation. So I've taken enough of the valuable time. So I'm pleased to introduce Dr. Dora Papadopoulou, who is the lead consultant for hip and groin section and for the military hip rehabilitation outcome study at the UK Defence Medical Rehabilitation Centre at Stanford Hall. She's the secretary of the Development Commission of the International Federation of Sports Medicine, the Secretary General of the European Federation of Sports Medicine Associations, and she served as the executive board member of the British Association of Sports and Exercise Medicine, the BASM. At national level, she was the chair of the annual BASM conference in 2019, and she's the chair for the Spring BASM conference 2021. So I want to welcome Dr. Dora Papadopoulou to the presentation today. I'm looking forward to this very interesting presentation and will now ask her to share her slides with us. Dr. Papadopoulou, the stage is yours.
Thank you very much, Stavros. Let me share my screen. Give me 1 minute. Sure. Perfect. So welcome everyone. Good afternoon or good morning. I don't know where you're coming from the world. It is a pleasure to be here with you today. Thank you, World Federation of Sport of Athletic Training and Therapy, for your kind invitation. And it's an honor and pleasure to be with you today. Special thanks to Dr. Glenn Bergeron and Oliver Coburn for your work behind the scenes, and obviously to you, Stavros, for coordinating this webinar today. Thank you very much for presenting me. Yes, I am a consultant in sports and exercise medicine, and I'm an orthopedic surgeon as well. So I had the pleasure, and I have the pleasure of working with athletes, and I was involved in sports events such as Olympics, Paralympics, Special Olympics since 2000, and I'm teaching the topic of sports and exercise medicine since 1998. So, and probably you know all this. What you don't know is that prior to the medical university, I graduated the sports university, and hence probably this is another reason that the World Federation of Athletic Training and Therapy is close to my heart. So when I asked to deliver this lecture, obviously I had to know more about the Federation, and I checked the mission, and I was pleased to see that the topic today fits with all this. And also I was really pleased to see that to attend a previous lecture delivered from two fantastic lecturers, Dr. Anthony Breitbach and Dr. Gerd Ulrich, and they talked about the interprofessional collaboration in the international sports science and sport medicine, and was really impressed, but also I'm really happy because this lecture today fits with this, and it's like connected to this topic, because both of the speakers talk about the science and the research behind it. And hopefully today I'm going to talk about how we implement this in practice, how I deliver this in my everyday working life. So to start with, I would like to say that no disclosures, yes, the topic, actually there are two topics, is the interdisciplinary approach and how we deliver this, and the implementation of the biopsychosocial model, and whether it is now the time to implement this in sports injuries and in sports and exercise medicine. And what it is, the biopsychosocial model is one of those things, that you probably feel like you should be doing it, but maybe for some reason, you don't know exactly how to do it, or you don't have the skills, which is not true. I think that every human being and someone who is well educated has the skills to do so.
Sorry for jumping in. I think we cannot see the slides right now. Can you just try if you can reshare the slides?
I haven't. Is that any better? Is my lights here?
The slides, we can't see the slides from the
Okay, I will do this again, but I haven't touched anything. I am in this screen. I don't know what's happening.
Yes.
Any better now?
Yes, now I can.
Perfect.
Thank you, Nora. Thank you.
Let me go back. So, so this is the place I work, because I'm going to tell you how you do this in your practice. I will tell you how we deliver it in our practice. And this is the place I work. I am really privileged to work in a state-of-the-art facilities here. I work in the Defence Medical Rehabilitation Centre in the UK, the main in the UK. And you can see we moved here just 2.5 years ago. And you can see here our facilities. We have a great big biomechanical lab. Many gyms, obviously, we have fantastic technology. You can see our current machine there, and we've been privileged that last year, just before the lockdown, the royal family visit us. So who we treat? So we have mainly young people from the service, but they can be athletes, they can be high-level athletes, they can have any kind of injury. But do not forget that the military personnel are so similar. There's so many similarities between the athletes and the military personnel, because they both need their performance. They both need their performance to continue to do well what they're doing. So I will show you two little videos that are not more than 3 minutes both. And please pay attention. These different people we treat here. Pay attention to the second video at the end, what our therapists are telling about the way we treat people here.
Steve was blown up in Afghanistan. Now he's fighting to get fit again. Here at Stamford Hall, he can use everything from specialist gyms to prosthetics experts, all under one roof.
It's life-changing. If I wasn't here, I would be sat at home, burying my head in my hands and struggling to cope with the amount of rehabilitation I'm having to go through.
This technology was used to animate blockbuster movies like Lord of the Rings, but here the grey markers and cameras are monitoring injured muscle activity to find the most suitable treatment. And over here they're using virtual reality, interactive gaming technology to teach people how to walk again. It's known as Karen, a pivoted treadmill that's linked to computers and 360-degree cameras.
That allows us to simulate real-world functional environments in a way in which we can challenge the patient and use for research, for clinical assessment, and for rehabilitation purposes.
It's taken 3 years to develop Stamford Hall to replace the outdated Headley Court, a transformation that cost £300 million.
Technology has also been a big part of the move to Stamford Hall. Technology has also been a big part of the move to Stamford Hall. Its biomechanical lab is much bigger and more advanced than its predecessor. Using the same principles as Hollywood animators, the treatment teams can track the movements of patients and then analyse their unique needs.
With the reflective markers placed onto the body, we're able to glean a vast amount of information about the way he's moving. Now that we can feed that back to the clinical teams and they can start to make bespoke care pathways or rehab programs based on the information that we're seeing from these sessions. And as he walks over the plates on the floor, we can get an idea of how he's distributing his weight. And if he's overloading certain parts of the body, then we can maybe tailor the rehab to stop further injury potentially.
They also have some entirely new technology at Stamford Hall. It could be mistaken for some kind of fairground ride. This is actually a computer-assisted rehabilitation environment, one of only 5 in the world. The wraparound screen can be used for a range of things, from showing patients on the treadmill how their body is moving, to turning the world around them to see how their brain and body cope. That's because many patients here have suffered injuries to their brains as well as their bodies. Lance Corporal Adam Nesbitt is recovering from a serious road accident, and he says the kind of care that he's getting here is absolutely essential.
I think it is very important because because of how my head injury works, I struggle with change and much change on things. So when I see how much work they put in, how much effort everyone puts in just for me on my own independently, it helps settle my brain down massively and how it all works, and I can then just understand it and believe them more and just deal with it.
For the people who work here, one of the important elements of Stamford Hall is the environment it creates for them to work with patients. There is great emphasis on not just rehabilitating the wounds that can be seen, but also damage that cannot.
There's always psychosocial overlay with any physical condition. So although we're predominantly a physical rehabilitation centre, obviously there's no health without mental health as well. So we very much look at both.
Stamford Hall is...
So, sorry, for some reason So it was clear, and that's why I wanted to pay attention to the second video, what the guy said, and they look at us individual, and then the lady, one of our therapists, mentioned about the biopsychosocial support we provide to our athletes, patients, and so on. And before I start talking about the two topics, again, I'll take just 2 minutes to talk about exercise prescription and the physical activity. And I know that all of you here in the audience, you're advocates of physical activity and exercise prescription for health. So, but it's all connected with the topic you will see later on. So coming from the UK, I live in a country where we promote a lot of physical activity, we treat with exercise, and this is what I do in my everyday practice. And this is the new TIF medical officers physical activity guidelines came just out, and as you know, just a month ago, the WHO provided us with the new physical activity guidelines, and you can see fantastic infographics for free regarding the physical activity for young adults, for children, for people with disabilities, ladies in pregnancy, and so on. So a lot of work is happening. And also we have some amazing resources. The Faculty of Sports and Exercise Medicine created this move, the Moving Medicine, which is an ultimate resource to help professionals like you to integrate a physical activity and exercise prescription conversation in your routine practice. So if you're interested to do this, please go to this site and educate yourself about prescribing exercises for different injuries and conditions. And this, of course, it's all for free. And coming from Europe and representing the European Federation of Sports Medicine, we worked on this project many years ago, and we call it Exercise Prescription for Health. And obviously, most of you, you're doing this in your everyday practice. How this is connected. So despite all the work we're doing, us and you, and I bet most of the people in the audience, this is the picture, unfortunately, I see every single day in my professional practice. So people, they like the easy way, and we talk about treating with exercises, but then you see that they don't want to get this. They want the easy solution. And sometimes what I say is, it's not what we say, but it is how we say things to people, how they can, our patients, our athletes can engage with us, how we can engage with them, how we can convince them that what we suggest is right. And then, as you can tell, I'm an old generation doctor. I've been there for more than 20 years. And as doctors and therapists, those we suppose they knew a lot. We used to do this a lot in the past, but I have changed a lot. I used to probably medicalize too much the normality. I used to bring a lot of medicine in my clinical practice, but with the help of people like you and my fantastic team, over the years, and all the evidence is out there, I have changed. So 20 years ago, 15 years ago, I had my, my medical cabinet. I would see my patient or my athlete, they will come, I will refer them, I will give them the pills, let's say, I will send them, I will give them an injection, I will probably send them for surgery, or I will perform the surgery. This is not happening that easy anymore, and you have the evidence behind it. So I have you here this fantastic infographic published just a year ago in the Journal of Orthopedics and Sports Physical Therapy, talking about the ways we are medicalizing people. And, you know, we kind of send them very easily for an injection or for a surgery. Some examples, too much medicine. Very easy, we'll send someone for a passive treatment, let's say, like acupuncture or something like injection or manual therapy, or things we know that they're not working that much, or let's say very easy, we'll give medication when it's not needed, when an exercise can help. We also use this we still use the strict language of when we explain the scans. We talk about those discs, about wear and tear, something cause to our patients fear, and they don't get it. So we can really make those things a bit more simple. Another example is we used to send very easily people for surgery. And of course, I'm a surgeon, I love surgery. But I think that 10 years ago, 5 years ago, maybe I would send someone with a labrum tear, hip is my area, for a surgery, which I'm not doing this anymore. What I'm doing instead, I explain to my patient how many people out there can have labrum tear, but they're not symptomatic. So, and the same with the results. So what you need a better communication with your patient. You need this interdisciplinary team to help you. You need to put your patient in the front and communicate, explain to them with a very easy language, interact with them, educate not only the patient, educate your team how to simplify things. And of course, try to implement this in your everyday life. So those are the things I wanted to start with, because, and then you will see that all those things are connected. We are going to talk about the interdisciplinary team today. And of course, you didn't expect me to come here to say that, oh, teamwork is amazing. You had Henry Ford, and that was more than 100 years ago, isn't it, when he said that working together is a success. And it is a success, but how we can do this to be biggest success. So please have a look to this, picture here, saying that a successful team is a group of many hands, but one mind. And this is what we're going to talk about today, the one mind and one goal. And again, I go back and I say what I said before. As doctors, sometimes we think that we're really important, and if you did a bit more studies and you have a bit more, you're more specialized, or you have PhDs and all this, you think probably that the things you're doing them better. But no, because someone like you who is equal to you and studied again like you studied, and he tried hard, probably he will say, if I said, no, this is the best way to do it, this is how I do it, he will say, no, this is the best way to do it, and this is how I do it. But with the years and having my brain open, thinking out of the box and collaborate with fantastic people like yourself, I learned that the good results are coming from collaboration. They're coming only when we're working together. And like 10 years ago, when this wasn't that modern, I started to say to people that it's a time to stop chipping away at our own silos. Such a lonely specialty medicine. You stay there in your cabinet with your athlete, your patient, and that's it. No, that's not the case anymore. So please, if you don't do it, I'm sure that most of you are doing it, stop chipping away in your silos, go out, share the information, learn from each other, learn from other specialties, learn from people they maybe know more than you in a particular topic. So this is my message today: stop chipping away at silos. It doesn't matter how well educated you are. And Of course, everyone knows about the multidisciplinary team approach to the patient and athlete's care. And we know that patient's care yields better outcomes when a comprehensive approach by healthcare professionals is used. We know that there are better outcomes achieved by those professionals when they collaborate at work and mapping out their prognosis and generate new ideas. And there's a lot of evidence. Again, I can send you as many links as you want about this. And we know that the multidisciplinary team approach was used for many years. What is this? So it's a team of professionals, including representatives of different disciplines, who coordinate the contribution of each profession, but is a very little overlap there. So those professionals working in parallel, but they have clear roles, each of them. So each of them, they will set their own goal with their patient and communicate those goals and the outcome with the rest of the team when it's appropriate. But remember, individual and clear goals. It is led by a consultant, team leader, and the same with interdisciplinary teams. Why interdisciplinary team? What is the interdisciplinary approach? So within the interdisciplinary teams, the participants of the team, now you remember, we didn't overlap the practice before. We share the goal, we don't have our own goal, and we overlap the practice rather than working on separate discipline specific goals. So those professionals of the interdisciplinary teams involved in joint problem solving, working beyond their own scope of practice to help their athlete. And the treatment goals overlap and collaborate with different disciplines, but what we have here is not like we're not going to collaborate when it's necessary, but we have regular communication between the team members. We sit together, we work together, and we're very close, and obviously we achieve much better outcomes. Many of you, they will ask me, are both approaches effective? Well, they work both. We've seen both multidisciplinary and interdisciplinary teamwork have been used in healthcare for years and years and years, but there are differences between them. And although I know the difference, and many of you probably know the difference of the two approaches, many educational researchers and practitioners, they cannot specify this difference, and they're getting a bit confused. And here we will see whether there is a difference. What is the fundamental differences? So the multidisciplinary teams work in a team when the interdisciplinary teams then engage in the teamwork. And I think that you can understand this. With a multidisciplinary care, we do not emphasize an integrated approach to care, and we're not able to develop this cohesive care plan as each team member uses their own expertise, their own goals is not the common goal for the patient. In contrary, each team member in our interdisciplinary team built on each other expertise and experience to achieve a common shared goal, which at the end will help better our athlete. And you say, okay, that's very good theory, and we have the evidence behind it, but how you deliver this, how it works. So in the military environment where I work, obviously, this is the interdisciplinary assessment following by rehabilitation or admission. It's a long tradition. So it's our everyday practice, and that's why I'm sharing my experience here with you today. So our patient, soldier, athlete will receive an intensive, goal-based interdisciplinary residential rehabilitation program when he's coming to us. So on the admission or in the clinic, we will see all those patient soldiers, athletes. We will undergo a comprehensive clinical assessment with each member of the team, but the team will work together. So then we will create a program which is individually tailored for them according their pathology and according their own needs and goals. And then the team will work very close, and everyone in this team, and I will explain when I say everyone, it will be involved in this joint problem solving. So I hope you understand. And how you run this, we talked about these lonely cabinets we had before. And this is actually, it's the next room, clinical room from where I am at the moment. This is our clinical setting at Stamford Hall. And obviously I had to take the permission of the team here to take the picture and use this picture for the purpose of the presentation today. This is the setting. So you have, you see here, you have your consultant physician or doctor. In the UK, the highly specialized physicians, we call them consultant. So like high level, you have your patient here, and here you have your whole team. So you have an exercise rehabilitation instructor, you have the probiotic trainer, therapist, you have physiotherapists, you have a podiatrist, you have occupational therapists. So this is only part of the team, it's not the extended MTD. But we have also the extended MTD or the extended ITD. And other than where we work with people other than the specialties we discussed about in the previous slide, the physiotherapist, the sports therapist, the doctor, and so on, we have a biomechanist who is going to take them in the lab and work with them. We have a nutritionist who is dealing with them. Recently, we had a lot of cases with rare cases, relative energy deficiency issues and stress fractures. So a nutritionist was heavily involved. We have a pain consultant, we have a pain psychologist, and because all these people, they need to explain things about their pain. We have a mental health specialist, and we have a vocational occupational therapist and social worker. Why? Because every athlete we will meet or soldier can be in different states of their life. And some of them, due to the injury, let's say, or for another reason, can be in the end of their career. So for these people, you know, the impact, the psychological impact this injury has in their lives, but also are so confused because, as you know, the soldiers and the athletes are involved in the sports and in the service in a very young age. So they have this identity from a very young age, and this is what they know to do well. They don't know to do other things. So you need to give them a bit of help with the social worker and the vocational OT, what they're going to doing in their life if they cannot be athletes anymore, and how they will transition to, say, civil life or the non-athlete life in the future. And we found it, excuse me, very helpful, because then our athletes can concentrate to their treatment rather than thinking about the future. And this here is another example, and of course I have again the permission of my colleagues. This is our another clinical room where we perform here ultrasound, and this is my colleague who is consultant musculoskeletal radiologist, and I could perform the ultrasound, but I'm not as good as he is. But all the doctors are here. You see our athlete is here, and I'm here as well. Not to tell him how to do his job, because he is highly specialized, but to help him with the clinical story. I know this patient very well, so I would probably say, look, don't look at the cruciate ligament, but look at the meniscal. Focus your probe there, or you know, and talk about the clinical signs. And the patient, our athlete in this case, this lady is an athlete, take part. So we are working all together in this room for the benefit of our athlete. So this is how we engage. And we talked about extended team, but why we need an extended team? You will say, wait a minute, these are like about 10 specialties. Why you need all this? Well, why? We know that the people we're privileged to work with those athletes. It doesn't matter what stage of their career they are special population, and the athletes as well. And they will be in a different stage of their career, of their performance. And we do know, working so many years with athletes, that one size fits all does not apply in sports and exercise medicine, does not apply in sports therapy. So you cannot do this. And that's why you need the extensive interdisciplinary team to support you and help you, because, as I said before, I don't know everything. And I always learn from my team. So understanding the psychological and sociological responses to injury and illness, it's vital for all the team. And this is something to consider in the future. I found this fantastic picture of a soldier who was an elite athlete as well, that in the future maybe know that the military can learn a lot from the sport. And the other way around, though, the sports world can learn a lot from the military. Why? Those people are so similar. So in the professional sport culture and in the military, there is a strong focus, as you know, on honing the body and mind of an athlete or a soldier to be an effective instrument. And unfortunately, this culture, until a few years ago, and maybe there is still there behind the scenes, this culture is supported in its context, in military, in sports, with people behind the scenes, with whether those are army researchers, there are strategic planners, or people that have direct influence with the individual, like the coaches, the trainers, us. So probably we need to look at it. And again, as I said, there it's a lot of evidence behind all this, and the evidence and the science is running. I've seen this consensus statement came out many years ago, like 10 years ago, in the Scandinavian Journal, it's a consensus statement talking about the psychology and the socio-cultural affect injury risk, response and recovery in elite athletes. And we know that elite athletes and high performance training and performance efforts characterized by explosive physical speed and strength and mental fortitude to push those physical limits to and maximum effort. So we know that sports injury occurrence in high-level sports and elite athletes, it's an adverse to and stressful health event associated with all this, with a complex multitude of risks, and there are consequences there. And only a few things, we'll talk about this later on. The examples of the psychological issues an athlete can have and can be associated with the sports injuries, as we said earlier. They create their identity very young, and this is what they know. These people, when they have an injury, when they have an illness, they lose their identity. And this is a huge problem for them. They have fear, they have anxiety, they lose their confidence, they're isolated, they're lonely, they feel not equal with their peers, they miss their peers, or they cannot do the same things. I have a lot of people saying, go back to the training to do what? To see my peers doing those trainings, and I cannot do it. I cannot stand this. And talking about all this, it's not a new thing, isn't it? If you go back 75 years ago and defined the health as given by the WHO, the definition for health, it was the state of complete physical, mental, and social well-being, and not merely in the absence of a disease or infirmity. So this is what we look at, isn't it? And it's not a new thing. It's many years ago, but how many of us we understand this? As I said before, probably it's one of those things, all of us, we know that it's important, and all of us probably we want to do it, but we don't know why, we don't know the evidence behind it, or we don't know how to do it. I'm just wondering, is this the biopsychosocial model the key to success now, 45 years later? So where this model came from? Before George Engel, we knew and we were familiar, and probably even a few years ago, we were familiar with the biomedical model. So the tissue damage, the joint problem, and the biomedical issue. But then 45 years ago, back in 1917, George Engel came and he argued that the psychological and social factors indeed influence the biological function and play an important role in health and illness. And coming back today and living at this strange year, I always say, if this 2020 leaves us with one good thing, would be the humanity left with us. And I want to think about this. I want to do humanity my philosophy in life. And I do this in my clinical practice. So please do not underestimate the importance of the biopsychosocial model, but make it, if you want, a humanistic philosophy. Make it a philosophy of care and a person focus. So yes, George Engel suggested that to understand a person's medical condition, in our case, our athlete medical condition, it is not simply the biological factors to consider there, but also are the psychological and social factors to consider. And continue with this philosophical aspect. Probably you all understand already that from my name and from my accent that I am Greek. So I'm looking at the philosophical aspect always. Looking at the biopsychosocial model, the philosophical aspect, what I would suggest to you, what I would advise to my young colleagues out there, look at the world through your athlete's eyes and walk through the world in their own shoes. And only then you will understand better how they feel. And you will then understand how you can better help them. So what is the biopsychosocial model? The three aspects there. The biological factors, obviously this is your joint, your knee, your hip, your tissue, your genetic material, the function, the physiology, your immune response to the illness, to the injury. And then you have the psychological factors, which the behavior, the beliefs, what is your personality. You have athletes that are going to say, I'll do this, and I have people I'm operating, I operate 2 people every day, and I have one of my patients will say, doctor, tomorrow I will be up, out and about, and I will not use the crutches. And the second patient will say, am I going to develop infection, and for how long I'm going to be with the crutches? So their personality, their motivation, their behavior and their beliefs, their emotions, their mental status at the moment, how much this injury affected their career? Are they able to make a decision? So this is all the psychological factors affecting their injury, affecting their recovery as well from their illness or from their injury. And also there are the social factors. And what are the social factors is the support they have. So you can have a Kenyan athlete, let's say, and you can have an American athlete. It's a different social support there, isn't it? It's a different availability. They have different availability to resources. They have different support from their families according to their ethnicity. The relationship, what about the relationship with the family? How much support they have in the family and how much they support them? One of the things I like to do is I will speak with the partner of my athlete or their husband and wife to explain about their injury, so they will have a better understanding, so they will be more sympathetic to my athlete. And this is probably something you see on the internet, or probably those that are not familiar, they went on the internet to see what it is. You will see these circles, 3 circles, and in the middle it's your injury. And this is the biopsychosocial model. And how we translate this, again, we have the biological aspect, which is your gender, your genetics, your tissue, your knee, your hip, your elbow, and your physiology. And this is your psychological aspect, your mental health, your emotional, your expectations, your beliefs, and this sociological, the social support, the dynamics, the relationship with your trainers, with your team, the support you have from there, and I do this, I see this in my everyday life. Why I see it so often? As I said before, I'm privileged to work where I work, but we see in our everyday practice almost only difficult cases. So my athletes, let's say, or my soldiers, they've been seen by many therapists before they referred to us, and they had various treatments, and maybe that cost them time as well. They're in different career states, and often we see them that they're taken out of their competition. Often we see that they are broken. And very often, if I have a hip patient who already had a surgery, let's say, but it wasn't successful, they will come to me and they will say, doctor, you know what, you're a surgeon, you understand how important it is to have a surgery. Can you please refer me to a good surgeon, and he will perform the surgery for me, and I will be all okay. And an example I like to give to them, is, first of all, I go and communicate with them and I ask them about all the other aspects, and I see that they're broken. There are many psychological issues going there and many sociological issues going there, and they had already one surgery. Why a surgery will cover all this? And the example I like to deliver to them, you see they'll have some bright walls behind me. And I said, can you imagine that, say that you now, you imagine that you have this big white wall, but this wall is broken, is full of cracks and holes and weaknesses. A surgery is, what a surgery will deliver is to kind of paint this wall with a very bright color, let's say a very nice yellow color, and cover all this. But this will be very superficial. Do you think that all this going to solve all the problems? It will not, because before we go and cover with a bright color this wall, I would suggest that we should treat those cracks, fill those cracks, repair those holes, and repair those gaps. And then our wall will be healthy. And then we can really indeed paint it with a bright color. And then you will be ready to go for a surgery when everything else is solved. And maybe at this stage, if you need it, the surgery will be helpful. And I'm sorry that I bring some examples to you. I think that it's very easy to understand, and definitely my patients understand it very well. And obviously, it's not me being that clever saying that it's a time to implement this model to sports and exercise medicine or in the sports world. There are people talking about this, but not sure how to deliver. And a year ago, I've heard, I listened to this fantastic podcast and blog in PGCert from Luis Tolo. Luis is the president of the Australasian College of Sports and Exercise Medicine, and you can find all this online, talking about the same and how she delivered this. And she brought this example. For example, if I have a lady who has a knee arthritis come to my clinic, I explain everything about those circles. So in this circle is your body. So probably you have a swelling to your knee, you have a weakness to your knee, and you have a weakness to the joint behind or below it. But then in your mind, there are so many things are going on. You have this sociological factor with the world around you, saying, I want really to play with my child. I want to play tennis with my husband, but I can't. And also I have so many stairs to go upstairs to my bedroom, and I cannot do this. How am I going to do this? And also my garden is so big. How am I going to deal with this? And then it's your mind. What's going on in your mind? Oh my God, am I going to need a surgery? And if I need a surgery, how successful this will be? And then, shall I play this tennis at the end? But probably not, because this will wear my joint more, and I'm so stressed what I'm going to do. So you can see that you can deliver this in your everyday practice. It doesn't matter whether you work with musculoskeletal conditions or you work with athletes. But I'm talking about athletes today because we do know that those factors are really, really more kind of not important, more prominent in their life, especially because they are under so much pressure, and these people, they need to perform. they need to prove themselves. And you will now tell me, come on, we have our life is so busy. How we're going to put all this together, and how we're going to talk about so many topics. And I want to say, if I can do it, I'm someone who sleeps like 2 or 4 hours a day, and you can do it for sure. I like this picture. This is for the seltzers in the room. This is for the chocolate lovers in the room. This is how my life looks like. It's sad. This is busy images, both, and this is how our life looks like. I'm sure that it's not only me. It's your life like this. But if we use the science, and if we use the research, and thanks God, a lot of people did this for us, and share our experiences as we do today, probably we will find an easy way to deal, an easy way to deliver this in our life. And as we said before, we are always based in evidence. And some lovely people worked on those topics. And here you go. You have another fantastic paper published just a few months ago in the Journal of American Medical Association. The practices to foster the therapist presence and connections with your patients, with your athletes in the clinical encounter. And how you do this? Well, it's not difficult. I saw you before my clinic, and this is what we do. When we meet the patient, we know almost everything about you. So prepare yourself with intention. Make yourself familiar with your patient you are going to meet today. So create a ritual to focus on your conversation with him. Make sure that you did your homework. Be ready for a meaningful interaction. So with my team, all of the people you've seen before, we did our homework. We know the patient who is going to come and meet. And then once your athlete is with you, please, please, please listen completely. Sit down, be all there for them. Position yourself in a comfortable position. Make them feel comfortable, and don't interrupt them. What I always say is that I have received your letters. I have received your referrals. We all here, the team, went through your story. We looked at your images. We looked at your operation notes, maybe. But the most valuable source of information here today, it's you. So we all here, although we think we know, and we trust our partners from where you've been referred, we want to hear from you, how you feel. And this is when you make this athlete trust you, and will relax, and will start talking about the things are important for them. So then agree what matter the most. So ask them what is their goals, what they want to do now, and what they want to do in the future. You can have an athlete who, you remember, Adi Mari said, I want to play with my children. I want to be able to do this. But you can have an athlete who says, I want to be the next champion. So I need to go to the next competition. So set the goals and bring these goals in the conversation. Connect with their story. Be a trusted partner. Celebrate their journey. I very often I will say, when we start opening, I'll say, thank you very much for being honest. You've been so helpful. You're helping me. And I celebrate this success and every success. And then explore emotional cues. Notice, name, validate their emotions. Make them feel valuable. Make them feel that you care. A few months ago, when we had the very strict lockdown and we had the video clinics, honestly, you think that this is difficult to do it via video, but I had a patient who has been seen by so many teams, has been seen for many years. It was a hip problem, she's still with us. At some point, I asked her, are you okay otherwise? Is there anything else other than your hip problem? She said, after so many years, she said, obviously she started crying, and she told me that, oh, we are the first people in her life asking about this. And of course, a tsunami of emotions came out, and we're still working since April with this patient. We have a lot of work to do with her in the future. But all this extended team was involved in her treatment, and she's doing very well. But was this little thing, this emotional bit, this listen to them and count them, that they are the most valuable source of information, which made the difference. Definitely it's not me. Definitely it's not just one person of the team. We're all together, the person who can bring this in the surface. And as I said, we have help nowadays. We have some amazing research out there, and I only brought you the easier thing to show you today. And this is again something came out a year ago in the British Journal of Sports Medicine. Again, I'm sorry, it's just all about British Journal. I happen to, and this is the roadmap to managing a person with, say, here musculoskeletal pain, irrespective of body region, but it's all the same by Carneiro and team. And you can go and look at this infographic, and you have 5 good practices to take home with you. What they say is, of course, all of us, we do this, we screen for serious pathologies there, and we manage health comorbidities. If there is something with any red flag, we need to make sure that we treat this, of course. But look at the biopsychosocial factors affecting their injury, their illness. And then, very important, embrace patient-centered communication. Make this communication happen. And by questioning your athlete, make sure that they understand their pain experience, the experience of their illness or injury, how they're coping. What are their coping mechanisms? Do they have coping mechanisms? What are their beliefs? Do they have concerns? What are their concerns? How this injury or illness impacted their professional athletic life? Are there any social factors there? What are their goals at the moment? What are their expectations from the clinic today? And then use this information to guide your examination and management. According what the information you get, then you will guide your examination and your management. And then, very important, embrace education as a central aspect of the patient care. We do know from the science that educating our patients is very important. And now one of the things we do here, and because of the pandemic, we deliver a lot of education. Our patients, athletes, they need to know about their condition. This will help them to manage their condition better. And now what we do, because we don't want to have them here for longer and spend more time with them, we will send them this education, so they will go through the education online the week before their admission, and they will have a better understanding. When they are with us, we will then explain better. So please educate beyond words, using any learning approach. If you want to put down the information, if you're good on, artists, you can ask them what they understand and start take your pencil and explaining there. Write down the information and coach them towards self-management. Why? First of all, empower them. Find good ways, find positive ways to empower them to engage with their treatments and the exercise treatment, and how you do this. Very often I will say, don't look at your going to the gym, don't look at the exercise as a treatment. Look at it as a part of your exercising, of your training. So have this tailor-made care and create programs individually made for them, but made for their own needs and goals as well. And don't forget to provide them this plan to self-manage when they go home, or when they don't have the access to you, they cannot find your mobile if you are their therapist over the weekend. Give them the tools to self-manage by helping them how to work towards progressions and regressions when they're symptomatic, what to do the weekend. So give them all this knowledge. And of course, access the comorbid health factors, integrating with the interdisciplinary teams and your own team. So you have all the evidence, and you have these little simple practices on how to do this. And if you need more evidence, this is another paper came out from Carneiro, and it's again, it's a few months ago, talking about whether it is time to move beyond the body region silos and manage this musculoskeletal, say, sports related pain actions, and some actions there to implement in your everyday life and change your clinical and therapy practice. And all these things are out there, and you can see, again, not going through everything again, what they say, it's again the same. Think, embrace, screen for the biopsychosocial factors, educate beyond words, coach to work self-management, work with your team, and see what you need working with your team to achieve patients and your goals. And as I said before, I can provide you more and more and more evidence, but I think that you don't need to more in order to convince you today, but we can have a conversation later on. So we discussed about so many, but many things. So I put a few tips and tricks there to take home, and some scientific aspect and medical aspect, and a bit of philosophical aspect. So my tips and tricks to take home today would be, please look at the world through your athletes' eyes and walk through the world in their own shoes. It will help you to understand better, appreciate the importance of the biopsychosocial model, and make it your philosophy of care. Make it your philosophy of life. It will help you whether you work with athletes or you work with patients. Have always a patient-centered approach and treat always we say this, your whole patient, not only their injury. Be very well prepared and know your patient before their arrival in the clinic. You will make them feel appreciated, and they will trust you more, and they will feel that you want to dedicate time to them. And then listen to them. Listen to them carefully without interruptions. Ask and listen to them. Listen to tell you their stories. Stop chipping away at the silos, and we have older or people from the old generation in your teams. Talk about those things, are good things. I always listen. My young colleagues, always, I'm learning so much from them. And the more I listen to you guys, the more I understand how less I know. Make a better use of the team. I would say make full use of the team. Ask about your patient's coping mechanism and try to find a way to help them with this. Discuss their expectations and goals. Inspire them. Empower your athlete to engage with their exercise treatment with different ways, and celebrate their success. When you evaluate them and you see that they improved in their tests today, please celebrate their success. Dedicate time to educate your patient and educate beyond words. Tailor-made the programs based to their own needs and not only to their injury. And this individualized care must include the psychosocial element. And something very important as well, I know that we work in the interdisciplinary teams, but sometimes we don't have the time, or we're missing things. We communicate with email sometimes. No, meet with your team and make sure that all your staff will deliver the same message. So make sure that if there is a consistency in the messages you deliver across the team, because we confuse so much the patients when we use this specific terminology, let's say, or a very special medical terms, or we want to say how important we are, maybe, I don't know, but make sure that there is this consistency there, and we deliver the same message. We agree with our podiatrists, we agree with our physiotherapists, and when we write this letter at the end, make sure that at the end, in the written letter, we deliver the same message for the therapists that are going to read this letter as well. There's not us in my life, and there is not us in my professional life. It's us, it's not me. So us is over me and beyond, and there is no space for egos between the members of our team. And you see, I will never use my team. I always say they team. And provide individual plan to help them manage with their symptoms exacerbations. As we said before, progressions and regressions. Remember that those patients, those athletes can be alone over the weekend. Remind them that when the symptoms getting worse, they have to step back and give them some tips and tricks. And something extremely important, where everything starts, we always start. We don't want to be that clever to treat. We want to be wise to prevent, isn't it? So, and I think that this was Einstein, it's not me for sure, but who said this, but is educate the next generation of therapists. So bring all these things in our universities, and maybe it means the outgoing and the ingoing therapists can create a better treating environment for our athletes, improve their performances, and have happier athletes and in the future. And with this, I wish you happy treatment, and thank you so much for being here today. And I do hope that the messages I did pass you today, sharing my experience, will be useful to your practice. And as I said before, please feel free, other than the questions we follow now, to contact me via email, via Twitter. I'm quite good in communication, and I will come back to you and I will discuss your questions and uncertainties if there are some. And thank you very much again, the World Federation of the Athletic Trainer and Therapy, for this invitation. And yeah, thank you for having me.
Dora, thank you so much for your presentation. That was really, really interesting. And one of the things that I would like to mention before we move forward and go through the questions from the registrants is that the setup that you've got in place at Stanford Hall sounds like a great clinical environment to work in. And I guess there will be many clinicians that share the same thought, and practitioners who would like to be within a team like this and work under those principles and philosophy. So thank you once again, Dora, for sharing your knowledge as well as your experience on this topic. So what I'm going to do now is I'll go through the questions that we received from our registrants. Well, I'm being aware of the time, and we'll try to finish on time. So I will start with the first question, Dora. And the first question is from Lucy, asking, how would you approach an athlete with a high sense of athletic identity who is in disbelief of how life-changing their injury is?
Right, obviously here, it is something we see all the time, and with very honest and very long conversation between me and him, but also the people of my team. They're highly specialized on this, and bringing many examples of the people who left the sport maybe, and they've been equally successful as coaches, or they had equally successful career. Bringing life examples probably is the way to go. And I always say that, and I know that the young people, when you talk to them about their health, they don't care. They want to know about their performance. But you speak about the importance of life and the meaning of life, and you ask them if they want to have a successful career for a year or two, or they want to have a happy life for a long time. And of course, as I said before, you will bring in examples, and you will bring the people, the sports psychologists and people that can support and in this direction as well. But bringing examples of successful people, ex-athletes, I think that helps a lot.
Thank you, Dora. Thank you for that. Moving to the next question from Ernest. In the services, servicemen and women have a responsibility to do what they are told by medical staff. How would you implement treatment plans in civilian life?
So as I said before, is because I work with both groups, and I used to work in a hospital as well with like normal people, let's say. And if we talk about, I'm not sure whether Ernest asking about athletes. I always say that this category, I mean, to be an athlete, I've been an athlete myself. So to be an athlete, you must be disciplined, and don't think that the service personnel, they will do what they think that we will tell them to do. So many times, what I say to them, it's, I've done what I could do for you. I want you to take the ownership of your treatment. So I share with you my knowledge, but it's up to you. So you have the ownership of the treatment. I can only advise you. You're responsible for your treatment. And you go now home and you do this. When you're coming back, I will perform all these tests. And the tests, they will tell me whether you did what you've been told or not. And what I noticed with the athletes and working different topics, let's say with the relative and energy deficiency problem, if I tell to my athletes that if you don't do this, your health will not be good, or one day you will have a stress fracture, let's say, they will not listen to me. But they will listen to me if I say that if they do what they've been told from the team, this will affect their performance. And probably this is the magic word. Don't talk about their health only, but talk to them about their performance. And we know that all these factors affecting their performance. And educate them, so bring the evidence to them and show them. Do you want to be faster? Do you want to swim better? Do this and you will have better results. And here is the evidence. I hope that this, and answering your question, Ernest.
Makes sense now, Dora, makes sense. Thank you so much for this one, for your input. Moving to the next question from Emily. How would you suggest bringing this type of model to administrations to try to expand staff to be able to meet all of these patient needs? And how do you show people who are focused on the finances the importance of this care model?
Yeah, so this is one of the questions I bet that many people, they will say, yes, you're privileged to work there and you have all these people around you. But I think that, okay, in the elite sport, we can do this, but I think that it's a bit more because of this part of the philosophy, it's kind of passion as well. And the pandemic showed us how to do this. And how we work during the pandemic when we had the strict lockdowns, it was so much easier to work online. It was so much easier to ask help from another part of the another member of the team while they're all at home, and then meet with this patient via virtual clinics. And well, this is why we're here today, to discuss whether this model should be applied in sports and exercise medicine, and start educating other people to bring this model together. So instead of having one expensive doctor there in your clinical practice, have more people who can contribute to the better treatment.
Perfect. Thank you, Dora. Thank you so much for your answer. Next question is, how do you manage expectations of patients if they have unrealistic goals that may not be possible for them to achieve due to extent or severity of an injury?
Yes, so this morning in my clinic, I was struggling, and I had a very strong physiotherapist who stopped me talking and analyzing and helping, and said, look, we worked together for 2 years, we've done this, you know that now is the time. You have all the tools, you have all the support, all the help, we're still here. You need to be realistic in your expectations. So you have to, so the more honest you are with them, the more they will appreciate this. So you start the conversation in the first day in the clinic, you ask their expectations, you feel that their expectations are very high, and because you're going to work with this athletes for a while, you mention this all the time. If they have unrealistic expectations, they will see this. They know that they're not, they cannot go and compete. I work with ultramarathoners. They cannot go and compete to the next ultramarathon because they will be symptomatic. And then you explain that if you have such high expectations and you go to perform there, then you are destroyed for long term. Give your body the time to heal, and then you can go perform better next year. So you try to explain why they have to be realistic, because it's good for them.
Good, Dora. Thank you so much. Thank you for your input for this question. Moving to the next one, we've got a few questions more. Moving to the next question from Jordi. Since most patients have never experienced any psychological modalities in regards to physical injury, what do you believe is the best way to get buy-in from patients regarding the psychological model?
Can you repeat the question? Sorry, I missed something.
Yes, Dora, yes, of course. Since most patients have never experienced any psychological modalities in regards to a physical injury, what do you believe is the best way to get buy-in from patients regarding the psychological model?
You mean that, probably I didn't understand the question, do you mean that some patients, they don't have the psychological issue there?
Yes, I think this is what I can get from the question as well.
Yeah, unless if Jody wants to explain a bit more whether she means that some patients, they don't have any psychological issues there. So, I mean, I'm happy to take questions later on by email. It's not a problem if she cannot explain, probably. But if there is not a psychological issue there, obviously you try to help with your big team and support with your sports therapist, with your physiotherapist, and just go through the normal pathway, let's say, not the normal, the regular pathway, if I understand the question right. But again, my email is available. We can discuss this.
Perfect. Thank you, Dora. Moving to the next one, do you think we should be expanding our scope of practice to incorporate psychological and sociological understandings?
Oh, definitely. And this is why I said, and I left it at the end to my tips and tricks. Start early. So put this in your curriculum, put this in your training programs in the university, and give them, those kids, the young, the future scientists, the time to get better and the time to learn. Can you imagine? I mean, I'm in this age and learning and learning and learning. I don't know enough. I'm learning all the time, and the more I know, the more I learn, the more I know that I don't know. And so, yes, all these things should be part of the curriculum, of the trainings in a very early stage. And you know, when we have these meetings with the interdisciplinary team, we learn so much from each other. So I will sit down, and if we don't have the time, then I'll go and find the member of my team and say, you said so, can you explain to me? And we have those lectures in our where I work, and we will attend those lectures, so we will know better. They will intrigue us, they will inspire us to go and learn more. And if all these things inspire me to learn more, can you imagine? I can't imagine how much they will inspire you, the next generation, the future, to learn more.
Good. Thank you, Dora. Thank you so much. And we've got the last 3 questions. I'm keep looking on time, so we will finish shortly. So this pandemic has added a new and very challenging can of worms in our therapy worlds. Coming from a varsity athlete setting and still with strict social distancing lockdowns, do you have any suggestions or strategies on how to best engage in with athletes? I'm thinking about some athletes who seem to have lost motivation and are likely having a hard time coping with online learning while going through with withdrawal from the temporary loss of physical in-person team dynamics. Thank you for the wonderful presentation.
Thank you very much. That's very kind. So now, recently I delivered a lecture to a big Germany, a conference in Germany, but the conference was a bit about technology. So, and we know that technology will be our best friend, maybe an enemy in the future, working with sport. And we've seen this during this pandemic. I mean, the amount of clinics I delivered via Attend Anywhere or other platforms was enormous. And initially, we didn't know how to do it, isn't it? I mean, I'm privileged because I lived 1 year in Qatar many years ago, 2014, and I was teaching in the university then, and I said, look, I have to leave the university, I cannot travel from Qatar back. And they said, no, we need to keep you, but we will train you to do this online. And this is how I have this experience. And it's equal. How you keep 10 students there entertained, how you entertain them for 10 days. I used to teach all day. The same with the athletes. We can make the technology our best friend here and find the inspiration through this technology and how make the technology our friend and deliver all this virtual, but find clever ways to do it. Our clinics were very successful because we kept our athletes and patients alive. You can find a way to inspire them, and you make sure that you have something to look forward. You make sure that they have to have something to look forward. The Olympics, the next training, the next competition. Inspire them to prove you things and inspire them to prove to inspire other athletes. Maybe just use your fantasy, use your brain and your positive thinkings to engage them. We know, we know. I don't live in an angelic world. I know that the performance is dropped. I know that many of these athletes are suffering. And to share with you my experience, I never seen such a, not difficult, but complicated patients in my life. So from March until now, if my time for the clinic is 1 hour, I have patients, they will stay for an hour and a half, 1 hour, 45 minutes, because they cannot cope. It's really difficult. And how you change this is up to you. Keep this enthusiasm. I'm an old woman. You see my enthusiasm when I try to teach you what I know. And the same with my athletes. The same with my patients. Show them that you care. Celebrate this success to them and say, I will come to see you in this competition. You can do it. Things like simple things like this in life. What inspires us inspires other people as well. I hope that this answering your question.
Good. Thank you so much, Laura. Thank you so much. And then the last two questions, actually, and then we can conclude this Q&A session. How can I implement communications with other therapists during therapy? Because for this, I would need extra time, which is not paid.
Yes. Now, so this is obviously, this lecture is probably a beginning to bring it to the surface, this topic, and ask people to start working in this area. Yes, the time is one of the problems, but obviously we can make better use of the time. The more we're working in this aspect and in this area with the interdisciplinary team, it's not the multidisciplinary team. Again, I repeat. The more we work together, the easier is the understanding and the less time we need to reach those goals. You will see with the experience, we need less time together. But as I say, you saw my clinic, my example of our clinic. We are in this room all together. So the questions I ask probably are the same questions you would have asked if you have been in your own time. So that is a way of saving time, isn't it? And then from the questions we will all ask, we will get answers probably would cost us in time to ask ourselves. But the more experience you have on the topic, the less time you need.
Good. Thank you, Dora, for your input. And this is the last question. Can I change belief if one says, everything's broken, I need surgery at last, even if symptoms are not that severe?
Now, this is my everyday pain. And I know that my team of therapists, like, why don't send them for surgery? Don't send them for surgery. And I will not. But I will try hard to get there. What I'm doing, I will explain what exactly I'm doing. If I tried everything, I cannot convince them. If every part or every member of our team try their own bit and they cannot convince them, bear in mind, I may look like very enthusiastic and I can convince you, but maybe Stavros or Jody or someone else from the team can convince, it doesn't matter what is their role, can convince more someone else. So give this role to someone else. They can listen to someone else. If, however, we come to this point where we cannot convince them and they do want to go for this surgery, which I believe that is not going to be successful, what I do, again with the extensive, myself, I will, again, I work with particular surgeons I trust and surgeons who understand our cohort, understand the demands of the athletes and understand the demands of a soldier. So I will write a very long letter and I will call my colleague and say, look, this is what I believe. And, but the patient wants to go through surgery. I do not believe that the surgery will be successful. In his case, he doesn't need the surgery, but you are the surgeon, the upper limb surgeons, let's say. Please let me know your opinion. But maybe if this answer or suggestion come from someone else's lips, they will, appreciate the answer better. And I just leave not the difficult part, I've done my bit, to them. So if the same answer comes from so many lips and probably comes for a consultant surgeon, at the end they will be convinced. And if the surgeon say, look, this is it, but if you still, we cannot stop them, isn't it? At the end of the day, it's their own body. They have to decide what is the best for them. I hope that is answering your question.
Perfect. Dora, thank you so much. Thank you so much for your answers. It looks like that we've no more comments, and I think the questions in particular have been excellent and really engaging. So thank you very much for sticking to cover all of those, Dora. And the presentation has been wonderful and really, really informative as well. So thank you for joining us and contributing to our WFATT International webinar. At this point, I'm going to invite Glenn Bergeron, the president of the World Federation of Athletic Training and Therapy, to conclude this webinar session. Glenn.
Wow. I have to say thank you very much, Dr. Papadopoulou. You did a great job. It's amazing how it resonated so much with so many things that I think that we all encounter on a daily basis with our athletes and with our patients. I need to thank you very, very much for coming to share your expertise, your wisdom, and probably more importantly, your passion. I think you really are inspiring a lot of us, and that's really the purpose of the webinars, is to inform and to inspire, and I think you've done an amazing job of doing that. I also want to take this time to thank Stavros for bringing you to our webinar community. Stavros picked you out of, I'm sure, hundreds of experts and said, this is the first person that needs to be to come and speak to us. And he's done a wonderful job of doing that. And I want to thank you, Stavros, for all the work behind the scenes of getting the organizing and also hosting the event. And Oliver Coburn is with BASRAT, and Oliver has been a mainstay for us for the World Federation, and that he helps with all the logistics behind the scenes, getting the platform set up for us, helping us with registration. And of course, he's in the background here right now and making sure that everything is going according to plan. And thankfully, we haven't had any glitches, and it's been great to see that happen. But I want to thank Oliver personally, and I want to thank BASRAT for working as a partner. Speaking of making sure that we work in partnership, this has been a great one for us. I want to thank all of you for coming. It's been just great. We've been so pleased with the registrations that we have for these webinars, and it just continues to encourage us to do more and more. And we will do that continually. So I invite you all to go onto social media on our LinkedIn and our Instagram and our Twitter, and join us and join in with the conversation as it goes on between these webinars. As well, I invite you to come to our website so that you can see what more that the World Federation is doing, and you'll probably get a little bit of a blurb in terms of who we are after this presentation. But come to the webinar or the website, see the variety of different activities that we're doing, in particular some of the upcoming functions. We have a journal club coming up it's going to be the very first one of our journal clubs, so you might want to come in and register for that one. I think it's going to be an exciting new way of communicating amongst ourselves again as well. And then we will be having an upcoming webinar. I know Stavros is already working on one, so we will have more to announce on future webinars. So I want to thank you all again. I know this takes time in your day, but I think I'm hoping that this was a valued investment of your time. And I'm sure that there'll be lots and lots of things to think about later on. So please keep up the communication amongst yourselves on this particular topic, and be sure to communicate with all of us. So before we close off, I just want to say to Dora that, Dora, if you look in your email, you'll get another link in so that we'll have a debrief right after this meeting. So thank you very much, everybody, and keep safe and keep well.
Perfect honor and a pleasure to be with you today. And please contact me and everyone in this webinar today if you have questions, of if I can help with anything. All right, feel free.